Hello everybody, Mike here from SurgTech Academy, and today I'm going to demonstrate one way to organize a back table. Now, one of the many things I love about surgical technology is that there are many ways to organize back tables, and each hospital, and dare I say each SurgTech, has the only way to do it. But in reality, I think there are two rules to remember that I teach my students. The first rule is that there isn't a right or wrong way to do anything. There's only sterile and non-sterile ways of doing things. And as long as it's sterile, it's safe, and I think it's okay. The second rule I tell my students is that you need to set up in a way that makes you comfortable. One of the biggest obstacles to overcome in surgery is anxiety. And whether you are nervous around a certain surgeon, or whether it's a certain surgery that you haven't scrubbed, you want to be comfortable in the OR. One way to do that is to watch other surgical technologists. Watch them how they set up, and then you can meld those techniques to become your own. Now, if things get stressful in a case, you want to make sure that your setup is automatic and you know exactly where everything on your back table is. So, I've already opened my supplies, I've scrubbed my hands, gowned and gloved. For the demonstration and education purposes, I do not have a mask on, but I think everything else is ready to go. Now, I've pre-organized this pack to coincide with many I see around the state of Iowa. But I understand that there are all different ways and all different arrangements in slightly different manners. And like I said earlier, there are many ways to organize a back table, but there are a few practices that I think are pretty universal and overall really good ideas. Now, the one thing to make sure is to cover your back table with a second layer, and whether that be half sheets or towels, I think it's a good practice to place a second layer on there just to reinforce the plastic of the pack and to help prevent instrument trays from breaking through. Now, since I have a ton of towels, I'm going to reinforce this entire table with towels. Now, the second practice we need to consider is which side of the patient will we be standing on so that we can dictate on which side to put our basin and pitcher. I like my basin, pitcher, and needle count pad close to me since I will be constantly using those. So I'm going to put my drapes furthest away from me because we will place those on the patient right away and we'll no longer need that end of the back table. So if I'm on the patient's right, the drapes are on the right. Patient's left, drapes are on the left. Now for my students, I pretend that we are always on the patient's right. Hence, my basin, pitcher, kidney basin, and all needle count pad will be put on the left so they're closest to me. I also like putting my pitcher closest to the end of the back table so that the circulator can fill the saline up for me. Now, one thing to remember is that it's a good idea for motion economy to try and only move things once. Now, I am demonstrating this, so I am moving some things twice, but just know that our goal is to move it once. Now, next we have to put the drapes in the right place. Now, we need to remember to have the drapes prepared and in order. At this point, I only want to put them in order because once my back table is completely set up, I will then often pull the tape off the tape drapes, pre-fold the towel cuffs, just to be completely prepared for when the surgeon comes in and is ready. Towels go into the back right. Four towels for draping, medium sheet. I'm going to put these under here. Next, Mayo stand. So we do have some knife blades and we do have some suture. Oftentimes I'll actually drape the Mayo stand first. I did it a little later this time, but I'm going to go ahead and do that now. I am going to prepare another video strictly for draping and organizing a Mayo stand. All right, so our knife blades go up there. Our one suture can go up there. Even your suction and your bovie can go up there also, I think. Now, a third practice that I think is pretty universal is that I find that the instrument set is at the back of the table with the instrument tips pointing out, and the set is usually centered. Now remember to stay at least 12 inches away from the instrument container when you retrieve the set. So when you retrieve the set, make sure you're 12 inches away, only grab the inside of the container and set it in the middle of your back table with the tips pointing out. Now the last practice that I think is pretty universal is that I see a lot of surgical techs using an instrument roll. I don't personally ever do this because I like the uncluttered look of keeping my instruments in the tray. But I do like the idea of having the instruments a little more forward so you can just reach them when you move back and you're standing and you want to grab something. So there's a couple of ways to do the towels. So one way I see is just to keep the towel folded in half and to roll it this way. I personally don't like this method. I like rolling it lengthwise and folding it in half. Now the reason I like doing this is because when I fold it in half, I think it's a little bit fatter and I think a little bit longer than we would have it just with half a towel. Once we have the towel down, we can pull out our instruments, set them on the towel, and I think we are ready to go. So that, my friends, is organizing a back table. I have my second layer in place. My drapes are on the same side as the patient. My instrument tray set is in the middle back with the tips out. I think I'm ready to go. So this is Mike from SurgTech Academy, wishing you a great day in surgery and reminding you to be a superstar in your OR.